Today we're going to talk about the patient dental records. You're already familiar with these records because you've been using them in the dental lab on your seating and dismissing task. However, we're going to dive into it a little bit deeper because in the future you will be adding more information that you will be responsible for in this chart. The first form is the registration form. This would be the form that the patient would fill out in its entirety when the patient arrives at your office. Patient information. Notice all of this information is confidential. It should not be being discussed with other people. Who's responsible for the account, and what's the insurance information if the patient has insurance. The last thing you always want to check on your patient information is that there is a signature and a date. The next form is the dental history. This is the history that you've been reviewing with your patient on seating and dismissing if they are still experiencing any dental problems or if they have new problems. The next one is your medical history for your patient. This is where you're going to look to see if they're on medications, ask them if they've added medications, talk to them about anything they have marked yes on here. Just be sure if anything has changed. Have they added something? Has something been deleted? So we always need to review this. Every time this patient is in the office, we need to review their medical form and their dental form. Now, as you notice, this is the health history update. This is what you've been updating after you ask your patient, has there been any changes? Do they still take a certain medication, or do they still experience back pain, or has anything happened to them recently, such as maybe they've been diagnosed as a diabetic, or maybe they've experienced a heart attack. So all of that needs to be updated, and this is the health history update. Here we have a date. It is very important that you put the month, the day, and the year that you are updating this medical form. I know it's a small box, but we have to squeeze it in there, and it has to be legible. This line is where you would make your notation. If there's no changes, that's fine. If they have experienced, maybe they've been diagnosed as a diabetic, this needs to be added here. Ms. Thompson also, I'm sure, has stressed to you that this form needs to be initialed by the assistant that is reviewing the form and by the patient so that the patient is in agreement with the assistant, any notes that have been made there. These are legal documents, and we need to know who updated it and if the patient agreed. So do not forget to initial it and have the patient to also initial it. Okay, we're going to move on. This is a part of the chart that or records that you have not experienced yet. As you look at this form, this would be a form that the dentist would come in and do the exam on the patient, and either the assistant or the hygienist could fill this out. These are clinical conditions here. So these are the permanent teeth. These are primary teeth. So we would have 1 through 16, 17 through 32, and then A would start here, and we would go through the primary teeth till we come back to T, right? So this is where we can make some clinical notes on the teeth. Maybe let's say this patient already had an occlusal filling on tooth number 2. So this area here would be shaded in. Over here we have other areas that we could fill out. Obviously there's the date, who was the hygienist, who was the doctor, was the health history updated, was there any kind of medical alert. So these are things that could be filled out during this exam. This would be for the exam maybe in January. Then the next 6 months the patient comes in, we would have a second area to fill out for the exam. The next page is going to be very, very important to you when we start practicing our composite procedures. You've already used this chart, this page, because you had to tell the patient what you were going to do that day in seating and dismissing. So it's very important that you understand how to interpret this page. Again, here we have primary teeth, A through J, K through T. Here we have the permanent teeth. So this is like a picture. Some doctors want it colored in what needs to be done and then maybe what's existing. So this is a picture of the patient's mouth. Now let's look down here at the entry. Here we have a date. So we have the month, the day, and the year. Here we have the tooth and the surface. So we're going to be looking at tooth number 4 at the occlusal. This 3 here is the time unit. So how long is he going to need to do this occlusal filling on tooth number 4? Each unit is 10 minutes. So that means the doctor needs 3 units. That means they would need 30 minutes scheduled. And then here we have the estimated fee. What procedure does the dentist anticipate doing? The composite filling. Over here we also have the dentist initials and we have the assistant's initials. Now, I want you to look at this very closely. I want you to look at the name of this form, treatment plan. Okay, so let's think about our patient has been to the dentist, they've had their teeth cleaned, and the dentist is saying that I did the exam today on 9/5/17. This patient needs an occlusal filling on number 4. I'm going to need 30 minutes and I estimate that it's going to cost them $95 and I'm going to use composite. Okay, so this is the treatment plan. This is what the patient needs. And again, pay close attention to this at the bottom because this is where you look to see what does my patient need. This is also the form that you're going to look at to set up your procedure. If you don't know what the dentist is going to do, then how do you know how to set up your room, your operatory? So here you know the dentist is going to do a composite filling. What if it were an amalgam filling? What if it were a crown prep? So you must look at the dentist treatment plan to know how to set up your room. Now I'm going to jump over here to a little bit of things that you should already know from DEN 100 with Dr. Foster. So let's look at these surfaces. So an M means a mesial, D means distal, O means occlusal, B means buccal, L means lingual, P is palatal, F is facial, and I is incisal. Now I'm sure Dr. Foster has already combined these surfaces with you. We may have an MO. That would be a mesio-occlusal. We might have an MOD, mesio-occlusal distal. So we can combine these surfaces to make larger areas of the filling. Here we simply have an occlusal on tooth number 4. So O stands for occlusal. If you do not know these surfaces, now is the time to sit down and memorize them. Okay, you cannot go any further without knowing the surfaces of your teeth, and you also need to be sure you know the tooth numbers. Now, let's look here. Here we have written out composite filling. That may not always be the case in the charting that some dentists do. They may just simply put a C or an A, okay? So what is a composite? And remember, we need to pronounce it correctly, composite. That is a tooth-colored filling. So that means the dentist tries to match the color of the filling to the tooth. If it's an amalgam, it's going to be a silver-colored filling. Does not match the tooth. It's a metal, okay? So you need to know how to interpret your treatment plan. So let's move on. The next form is the progress notes, okay? So your patient has come back today and this is the treatment plan you have set up for. Now you and the dentist have worked on this patient. So the progress notes, this is what has been performed on the patient, okay? So let's say that this patient, this treatment plan was planned in 9/5/17. So let's go to the next one. Let's just pretend we're still in 2017. Here, if the patient came in today and it's September the 15th, then we want to put that date here. So we would put 9/15/17, or today's date, we would put maybe 9/15/2020. So this is the date for the progress notes. This is where you record what you have actually performed on your patient's tooth. All right? So we did number 4, we did an occlusal. Was anesthetic given? Yes. And then out here, we're going to write the treatment. So what did we do today? We're going to give all the information that we did today on the patient on this date to this tooth. All right? Then over here, your doctor needs to initial it, and the assistant or the hygienist needs to initial it. So remember the difference between the treatment plan, this is what needs to be done to the patient. The progress notes is what has been performed or what we have done to the tooth. This is the current. Okay? All right, the last page that we don't do a whole lot with in the dental lab is called the correspondence log. If we had to send an x-ray to a endodontist, that's a dentist that does root canals, and we sent them this patient's x-rays, or our Dr. Smith talks to Dr. Jones, that could be recorded here. So correspondence is any time that the dentist talks to someone in another office, they have a place to record those notes. Okay, I hope this will help you a lot. Be sure you pay close attention to the records when we say treatment plan. This is the way to set your room up. Progress notes, this is what you have actually performed on the patient's tooth today.